Welcome to the Rehab Runway, presented by Health and High Performance, where we take you from the treatment room to the track. I'm Luke Nelson, a sports and exercise chiropractor, running coach and strength coach, and for over 2 decades, I've worked with everyone from weekend warriors to elite athletes. My mission is simple: to get you moving again, uncover what's really holding you back, and help you run stronger, smarter, and injury-free. Whether you're a runner returning from injury or a health professional looking for evidence-based insights into rehab and performance, this show is for you. Let's get started. Well, I'm thrilled to finally launch this podcast. It's been years in the making, and I've spoken about to close friends about doing this for a while, and it's often been pushed aside by demands of work and family life. But now, after a few years, I'm fully committed to bring this back to life. So, why this podcast? Well, at my core, I find purpose in helping others, whether that's with the patients that I treat in clinic, the runners I coach, or the health professionals that I teach through my courses. This platform just provides another opportunity for me to reach even more people, hopefully, and share insights that I hope can make a real difference. It's also part of a selfish, I guess, purpose as well too. Is there's lots of people that I want to chat to and bring on this podcast, pick the brain of, and actually help me become a better practitioner and coach as well. So there'll be a mix of throughout this. There'll be a mix of solo episodes and also inviting some guests on as well too. And the primary focus of this podcast will be my greatest passion, which is running. Each episode is going to be designed to implement some and discuss some practical, evidence-based and relevant topics. And that's going to be also applicable whether you're a health professional working with runners or just working with active people, or you're a runner yourself looking to stay healthy and perform at your best. So just a little bit about myself for those that don't know me, as an introduction to this first podcast. But primarily, I'm a dad. I'm fortunate to have a very loving and supporting wife, and I've got 2 young kids, Madison and Jack. So giving you kids a shout out, even though they're probably not going to be listening to this. I'm a sports and exercise chiropractor. I've got over 20 years of experience. I'm situated at Health and High Performance in Melbourne, Australia, where I've been for the last 5, 6 years. I'm a qualified run coach and strength coach, and this is something that I found myself evolving into over the years as a health professional, found myself treating more and more runners and naturally drawn to that side of things. And so, yes, for a while now, I've been a run coach, and that really allows me to take people from the treatment room out to the track and performance. And that's, again, one of the reasons why I've named the podcast as I have, because this is all about not just helping people in the rooms, but also getting them out there and doing the things that they love. I'm a runner myself. I've just recently completed my 11th marathon at Sydney, and getting prepared to pace the half marathon this weekend in Melbourne, which I'm really excited to do. Pacing was something I started last year and paced the Melbourne Marathon. Really enjoyed it, and again, coming down to that, I guess the helping others and helping them to achieve their goals. So hopefully all goes well on the 1 hour 35 bus this Sunday for the half marathon. So for our first episode today, I thought what we're going to talk about is we're going to talk about one of the biggest myths out there when it comes to running, and is running bad for your knees and hips. And this was recently triggered by a post that did the rounds on my social media. It was actually from a plastic surgeon over in the US, and he basically said, no one should be running. It ruins your knees, ruins your hips, makes you shorter, and also makes your skin sag, which is a new one. I hadn't heard that one before, so I guess I better be careful of that one and booking my plastic surgeon appointment in years to come. But amongst my circles and obviously amongst a lot of runners, know that this is that running does not, hopefully, does not lead to these sort of conditions, but there's a lot in the general public that do think it is. And so what we're going to talk about is we're going to talk about what the research actually says, why this myth persists, and what runners and clinicians should know about that. And this episode can be shared to anyone out there that accuses us runners of causing damage to our knees and hips. And so firstly, just to discuss where the myth comes from. So I think the origins of this, I think, come from the thought of it's wear and tear, and almost like this mechanical approach to the human body, in that if you use it more, it's going to break down. So thinking of it like a car, if you drive your car more, it's going to wear down faster and going to lead to problems down the track. And that was probably the thinking, and a lot of people still do think that way. But what we know is that the human body is amazing and adaptable. And so what happens is that when we stress our body repairs and builds it up even stronger so that it can prepare itself for the next thing to come. And this is essentially what training is. Training, whether that be in the gym, whether that be running, we exercise. The body essentially breaks it down and it builds itself back up then to make us stronger for the next time. So the human body is not a machine. We are an amazing adaptable organism, and if we stress it right to the right amount, the body can adapt to that. I think also another thing that feeds this is probably the media amplifying fear with headlines like "running destroys your knees." We know that sort of this controversy and headlines like that certainly get clicks. So I think there's an element of that fear mongering out there that the media might be responsible for. Um, and then there's also sort of the anecdotal stories of my uncle or my friend ran a marathon and now they've got knee arthritis. I think the other thing too that we see with that is that because running, I mean, one of the more common injuries that we see in runners is what's called patellofemoral pain, and that's basically kneecap pain. And so there's a thought there that, oh, because I've got, pain, then that is, and this patellofemoral pain, then that means that I'm going to, in 10, 20, 30 years' time, that's going to lead to osteoarthritis. And we know that that's not the case. So whilst knee pain can be a common ailment in runners, it's actually very different to knee osteoarthritis. And so what we understand is that the other thing too with osteoarthritis is we used to think that it was just pure mechanical wear. So, use of the joint there wears it down. What we know though, and our current understanding of osteoarthritis is that it's actually more about the person as a whole. And so we know that there's things like, certain biological and genetic contributions and lifestyle factors that play a role. And in fact, one of the current approaches to osteoarthritis is recognizing it as a whole body inflammatory process. And so it's not just a joint that's affected, but there are signs of inflammation throughout, into the blood and other areas as well. And so trying to make that individual healthier, not just focusing on that joint, making that person healthier can actually help with that osteoarthritis. And that's where running comes into play. So, what about some of the research that's looked at knee? We'll start with knee osteoarthritis first, and we'll also talk about hip there as well. But firstly, in 2017, there was a study that found that runners actually had a lower prevalence, so a lower occurrence of knee osteoarthritis than non-runners. And there was actually a really big study by Alan Gelly in 2020 and 2017, and they looked at 100,000 participants. And what they did was that they compared non-runners to recreational runners to elite athletes. And what they looked at, they examined the incidence of hip and knee osteoarthritis in this 100,000 people. And so this was in the Journal of Orthopedic Sport and Physical Therapy. And I'll post, actually, I've done a couple of blogs on this in the past too, so I'll post these in the show notes. And what they found in this 2017 study was they found that recreational runners had the lowest rate of knee and hip osteoarthritis at about 3.5% versus non-runners that had 10.2. So it was sort of quite a significant jump there for people that did not run. Now, interestingly, what they found was they found that actually the elite athletes had the highest level. So we had the recreational runners the lowest, the non-runners in the middle, and then we had the elite athletes at the highest rate, and that was at 13.3. Now, what the theory perhaps and the reasoning behind that might be is that there is too much of a good thing. So running at a reasonable amount can help your joints. But if we do too much of it, and this is where we're the elites here, then that may not be such a good thing. Now, the other thing, I guess, is that elite athletes may be more, and again, having worked in elite sport in the past, there is certainly a push for performance rather than health sometimes, and so there is things like in the past with anti-inflammatory and steroid use and cortisone injections, all those sort of things which we know are not great for joints. that can be used more in the elite setting because they just want to get up for their race, and that they may do things that aren't particularly healthy for joints. So there's a couple of reasons why that might be the case, but there is too much of a good thing. So for recreational runners, yes, elite athletes, they can be at a higher risk than your non-runners. There's also been a few studies that have looked at imaging, looking at X-ray and also with MRI imaging. So a 2023 study by Dillon, they looked at comparing X-rays, and what they found is that there was no deterioration of any signs seen on X-ray. They compared actually between runners and non-runners. And there's been a few studies that have looked at MRIs as well too, and that's been done by Laura Horger. She's done quite a couple of good studies actually. And what she did was she took a group and she looked at the effect of training for a marathon and what that has on knee health. And they took 82 healthy adults, sorry, and they put them through. This was their first marathon. So what they did was they did an MRI scan before the event. They did the marathon, and they scanned them after the event. And interestingly, what they found is that there was some improvement in some of the things they saw in the pre-scan. So in this previous scan, compared to the post-marathon scan, they actually found that there was some improvement in the subchondral bone damage. So that's the joint surface, the bone underneath the joint surface there. There was an improvement of that with the marathon, where they're actually doing the marathon. They did find some worsening of the patellar cartilage, so that's between the kneecap through there. But this was asymptomatic. So running a marathon did not result in any immediate worsening of issues through there, and in actual fact can improve. And this is an interesting one. I think that again, to show that some of these things can actually be improved with use, and it goes back to this whole talking about the body's not a machine; it's an adaptable human being. And we know that certainly from a joint perspective, it likes that movement. Now, why are some of the reasons that running can help with knee osteoarthritis and hip osteoarthritis? One is that movement. Again, joints love that, and that's how they get their nutrition and the fluid circulating through there. It also can stress the body to improve the subchondral bone, as we saw before, and also improve the strength around those muscles. We know that a big part of managing osteoarthritis is improving strength around that joint to take the force away from that joint through there. And also another big part of managing that is keeping a healthy body weight. And potentially with running, certainly can improve strength around through the knee, but it also can help to maintain a normal or better BMI. And also we spoke about before about that whole body inflammation, and exercise, not just running, but exercise in general can also be quite good to help with that, and also preventing some of the metabolic conditions, so things like diabetes and pre-diabetes there as well. So for that, in terms of from a knee point of view, recreational running is joint protective and not damaging like what some would think. Now, if we move up a little bit higher around through the hip, well, going back to that 2017 study, again, they looked at hip and knee osteoarthritis. So they found that, again, the lowest rates of hip osteoarthritis were amongst the recreational runners, then the non-runners, and then the elite runners through there. So we can see from that study there. Again, Laura Horger has done some good studies on MRI looking at this, the damage around through the hip, or potential damage around through the hip there. And what they found is that they had, their first study, they had 52 participants, and they compared inactive inactive people versus moderately active and highly active runners. So they sort of subclassified them in terms of the amounts that they were running. And they found that there was actually no difference among those populations through there. So between the non-active and the different populations of runners there. So the conclusion from that study is that running does not add or worsen any damage around through the hips there. And they also looked at at the effects of running a marathon on joint damage as well too. And what they did was they performed an MRI 16 weeks before the marathon and then 2 weeks after the marathon. and they found that there was no changes in between the pre and the post. So training up for and competing in a marathon did not result in any worsening of the joint there. So same sort of reason again before. The hip is not just a joint that wears out like a machine. Things the body can adapt around that, can strengthen it and also nurture that joint there. Now, one of the other sort of common complaints that we hear around, whether that be around osteoarthritis is clicky knees. So that's something that's, I frequently get asked about, whether that be knee or hip is the other one as well too. And the concern there is, as horrible as what it sounds like, people are concerned that there is some increased wear around through that knee. Now, we still don't quite know where that noise is coming from. There's a couple of potential reasons there. One is it actually is the fluid behind the kneecap, so between the kneecap and the thigh bone there, or the patellofemoral joint for the health professionals there. So as we move around, there can be like a squelching in that joint, and that can often sound like sand, and sand grinding in the joint through there. And that's what some people will complain of. They say, "Oh, it feels like I've got sand in the joint there, that creaking joints." And so that's one of the first things there is it could be that's a gas bubbles, but there are also some soft tissues around the knee like tendons and the synovial plica that can move around. And I've actually got one in my knee. I've got a synovial plica thickening and it makes a really big click when I go up at a certain angle on a step. But it is no, I've got zero symptoms and I've learned to live with it. So what does the evidence say around noisy joints? Well, crepitus is very common, and in fact, a previous study that looked at 250 asymptomatic knees, they found that pretty much 99% of them had crepitus. So most people will experience some clicking and noisy knees. It's pain-free clicking, so we want to differentiate when someone does have a clicky knee. We usually want to differentiate between is it painful or is it painless, and if it's painless, most of the time it's benign, so that's usually nothing to worry about if there's no pain aside along with it. And thankfully, from Silver's research, they found that a noisy knee is not a sign of severity. So even if there is pain, so if someone's got patellofemoral pain, kneecap pain, and they've also got some noise around the knee, they found that it's not related to the severity. So people with a really noisy knee versus those that don't, it wasn't correlated to the severity of symptoms at all. And they also found that there was no difference between strength and function and pain as well too. So those without and those with noise. If there is clicking around the knee and there is pain associated with that, that may indicate pathology. It may be unrelated. As I said, you can have patellofemoral pain and a clicky knee. And then what we often find is the patellofemoral pain, we manage that pain goes away, but sometimes the clicking remains. So that can certainly happen. If there is a pain, there are certain conditions around the knee that can result in a painful click. Some of that may be a meniscal tear can sometimes do that. That may be associated with locking, but there's also some debate about that as well too. So I guess the primary thing there is if there's any concern, then get yourself assessed by a good health professional to determine if it's relevant or if it's not. But just remember that clicking is very common, and as I said, up to 99% of asymptomatic people will have clicking around through the knee, and it's not thankfully a sign of severity around there. So be reassured. So to wrap up, and it's a nice sort of short, sharp one for today, but just wanted to get this one off the bat to start with and start on this process. As I said, I've been thinking about this for a long time, so this is me committing, and we'll be putting out regular podcasts from now. I've got a big long list of people that I want to invite and speak to and pick the brain of, and I've also got a lot of topics that I can talk about myself. So to summarize this, running is not bad for the knees or the hips, and that recreational running is often protective. Elite runners are a different sort of fall into a different basket there, and that there are some potential evidence to suggest that it can accelerate their knee osteoarthritis, or they can have a higher risk for developing that. Clicky knees are certainly common, but it's usually benign, so it's usually nothing to be concerned about. So for takeaways, and this is how we always want to wrap up these episodes, these podcasts, is if we have some takeaways for our runners is to realize that don't fear the joint noises. Certainly don't listen to those around you that say that running will give you knee or hip osteoarthritis. you can certainly share this episode with them. Concentrate on doing your own thing. Progress gradually as well to listen to your body and make sure that you're not doing too much more than what your body can handle. For the clinicians, well, hopefully all of you out there know that this myth is a myth. You can certainly share this with those patients and runners that have some concerns about this. But we certainly want, as health professionals, we want to reduce fear and encourage our runners to keep active, which is really important for reducing those risk factors for osteoarthritis. So, is running bad for your knees and hips? The science says no, and in fact, it's one of the best things you can do for your joint health. And for those clicking knees, if they don't hurt, it's not a problem. If you've enjoyed today's discussion, share it with your fellow runner or patient who's been told to quit running before they ruin their joints. You'll find links to the studies and the blogs we covered in the show notes. Thanks for listening to the Rehab Runway. I'm Luke Nelson. Until next time, keep running strong and keep running smart.